So we just finished restoring rotation at the T1, T2 joint, the uppermost thoracic joint, which is just below your neck. And on the first day that you came here, I treated the first rib, which lacked transverse plane mobility. And very few clinicians treat the first rib in the transverse plane. You went to a chiropractor for about 4 years?
Different chiropractors.
Yeah. How many different ones?
4.
Okay. And you had consistent complaints of tightness in that upper part of your thoracic spine?
Mm-hmm.
And did you ever get relief from that?
Everything above and below I did, but not that one, not the T1.
Yeah. And you still would tell him it still felt tight?
Mm-hmm.
Yeah. Well, I have a theory that manipulative technique might not work at the T1, T2 joint. It has a lot less rotational mobility than the cervical spine. I think it's a lot easier to manipulate the cervical facet joints. But that T1, T2 is a very different entity because it has a rib attached to both sides of it. I have other video where I demonstrate how I treat transverse plane restrictions of the first rib. But let's have you lie on your stomach and I'll demonstrate how I restored rotation to that.
Yeah, that's great.
So I tested him by dropping this down into neutral. And then I dropped it down in flexion, and I came on the lateral aspect of the spinous process of C7 and T1 and T2, and I did spring testing, passive spring motion, and then I got on the other side and I tested pushing it to the right. And what we found was that when you were in extension, we found a distinct blocked motion at the T1 vertebrae. So to help it, and so that implied, because the vertebrae has this projection in the back called the spinous process, if the front of the vertebrae rotates left, then the back of it goes to the right, and that's why I could not spring it, pushing it to the left. So to help it rotate to the right, we had him rotate his neck to the right. So go ahead and turn your neck to the right. And then we had you side bend your neck to your shoulder, chin to shoulder. So he was now side bent right, rotated right, okay? And then I kept my thumb on that vertebrae, but I captured the one above and the one below. And I believe that that's a more effective mobilization than just trying to mobilize only the one that is restricted. So I capture the one above and the one below, and I'm pushing at about a 20-degree angle. So my arm is not straight across, it's at a 20-degree angle, and then it's at a 20-degree angle downward as well. And I just push into it firmly, and I maintained that force for 3 minutes. And after that, we straightened him out, and we retested it, and it was much better. And you got up and moved it around and tested it, and what did you find?
I couldn't get it to hurt.
Okay.
Like it usually would.
Okay. And then I showed you this trigger point cane. I found this at Target, but I've never seen them there again. I don't know. There's different types of these, okay? I just happen to like this one. And what you can do is test it once a week and hook this little ball on the right side of that spinous process, and then pull on it. Can you go ahead and film me? Can you get on that camera and direct it towards me? So the self-treatment would be for him to take this trigger point cane and come to the right side of the transverse process, spinous process of T1, And you could test the one above that. You could test T1, and you could test the one below that as well. And your tightness was mostly when your neck was extended, so look up and then test compressing it, all right? And test the one above that, and test the one below that. If you find tightness there, then you keep your head extended, and you look over your right shoulder, and then you drop your ear to the shoulder, and then you just push on that, and you do that for 3 minutes. So this is a one-time correction. On my hourly rate, it probably translated to $35 for the time I spent doing that. And you're now independent. You don't have to keep coming back and seeing me. And that's my model of healthcare, is to make the person independent on the first visit, or the second, or the third. And this was your third visit.
Mm-hmm.
Do you feel like you can now manage that joint by yourself?
Absolutely.
Good.
Yeah.
Wonderful. And so again, based on my experience, I do not believe that traditional chiropractic treats the first rib in the transverse plane. I have other YouTubes on mobilizing the first rib that you can refer to. My last name is Hesch, spelled H-E, S like Sam, C-H. So you can go to YouTube, type Hesch first rib, and you'll find the treatment for that. And then you can find video on treating the T1, T2 joint. I'll certainly post this one. It might be the only one I have on treating the first thoracic joint. But again, I think there are certain joints that the chiropractic model does not correct. And you had 4 years of them trying to relieve your spinal pain and your neck pain without succeeding. So I think we have some objective evidence there to support my contention. And there's other joints that I believe that they do not adequately correct. I'll do a separate video and talk about those other joints. Thanks for being a subject. Thanks for letting me share this.
Yes, sir.